Hi, welcome to Dialogue with Doris. I'm Doris Herbert Robinson, your host. My, do we have an interesting show for you today. It's cutting-edge information. And we have with us Dr. Rick Collins from the Collins Chiropractic Center. Did I say that right, Doctor? Collins Chiropractic Center. And he is going to tell us about this new technology with Healing Rocks, the synchronization of the body's vibrations. Dr. Rick, welcome back to Dialogue with Doris.
Thank you, Doris. It's good to see you again.
Thank you. Now, this breakthrough, the breakthrough healing science of the 21st century. What are we talking about, Dr. Collins, when we're talking about Healing Rocks?
Oh, okay. You surprised me with the first question, but
yes.
Let me see if I can give some answers for you.
And then I want to come back and talk about other things you specialize in as well.
Okay, terrific. First of all, let me thank you for allowing the office to come on and give a demonstration a little later, as well as a little explanation of the works that we're doing in the office at this point. So basically, what we're concerned about is individualities of people. And this is why the work that we do is called specialized kinesiology. We really feel that each person has special needs and special problems, and those special problems have to be addressed. So if we have a person come in, we're more concerned about not the things that are good on them, but more concerned about the things that are bad on them. So basically what we've done is we've implemented a number of different procedures through the years to benefit those individuals, mostly with, and when I refer to these cases, I'm really referring to the chronic case, to the person that's had a problem for a long period of time. Problem that they've been to doctor after doctor, practitioner after practitioner, whether it be in alternative fields, be chiropractic or massage, acupuncture procedures, or whether it's been through more like traditional means, such as medical procedures, hospital settings of that sort. And they still come in with complications. This work is really geared to take care of that individual. Unfortunately, we also have work that's geared to take care of the person that maybe just had a car accident, just twisted their leg going down a step, just twisted their knee dancing. There are also procedures that are included for those individuals also. So again, I thank you for introducing us to the area.
Thank you. Now, you, along with this new technology, Healing Rocks, you also specialize in TMJ therapy and kinesiology as well. Did you want to speak to that for a minute before we go deeper into Healing Rocks? Or?
Absolutely, absolutely. Okay. Yes, and basically what we feel is, and as all practitioners in the alternative forms feel, that the body is integrated, which basically means that an arm is not an arm. You're not a car. You're not a machine like a car where a bumper is strictly a bumper, and if you dent it or damage it, you can remove it and put another one on, and the car looks the same, as we've all seen at these old car fairs and nights in different towns where they have the old cars that are repaired, look just like they were on the showroom floor, but we're a living source.
I see.
By that, it basically means that you can't take an arm off and put it on and have it work the way it did before. But what you can do is you can use the ability of the body's internal wisdom, let's say, or the ability of the body to heal itself. And we all know that the body is able to heal itself if given the proper tools. My job is to give those tools in the best, most effective way possible. And that's what the Healing Rocks are about. That's what the work with the TMJ is all about, which is the jaw joint, because of its very extensive connection to the brain and the ability of the brain to be able to flow. Again, and the brain activity and flow means a pumping activity, a movement of fluids, which is part of what the Healing Rocks are all about. In the 1970s, late 1970s, Dr. Pop introduced a theory to the community, to the scientific community, on quantum physics. And that basic concept is the fact that each part of the system is a moving part. It's got a vibrational rate, it's got a pulse rate to it, and that pulse rate has to be maintained. And if not maintained, then the person gets very, very ill. My job is to introduce systems and ways to make those pulsations occur in the normal way.
Now, I noticed you said 1970. That's a long time. It is just, this new technology has only been around for a year or so. So for many years it was being researched, I imagine.
Yeah, it's just being introduced recently. Right. But the research has been going on since the, well, first of all, the quantum physics concept was introduced in the 70s, that concept was then introduced into the mechanics of the human body. And then those mechanics had to then be examined and very, very thoroughly. They've researched these things for years and years and years before they come up and introduced it to the general public or the general practitioner so that they can use it in the office so it's consistently proper. And there's no oops or there's no mistakes with it. That's really the reason why.
Okay, then I would like to find out whether these, we were calling it technology, these healing rocks. Does that mean they're man-made, or why is this technology? That these rocks are not coming from the earth?
No, they're not. No.
That's a good
most
question.
people, when you hear rock, you're absolutely correct. Most people, when they hear about them, because most of the time when people come in and they refer another individual into the office, I'll always ask, have they told you about the procedures that we use? And no, they just said it's a little different than what you may have seen in the past. And I think most individuals are aware of rocks, of quartz, and different gems that are used. This particular apparatus has been man-made. It's been scientifically discovered. It's been introduced through the Journal of Manipulative and Physiological Therapeutics. And what it is, it's in a particular configuration with particular components on the inside that will generate a very subtle, gentle, non-feeling to the outside surface, kind of like a dog whistle. You can blow a dog whistle and it looks like you're doing things, but you don't hear the sound. But the dog has a little different sensitivity, and the dog does feel the sound and does respond. The rocks are in the same fashion. What they basically do is they get into the body, your skin doesn't feel it, but the internal mechanics and the internal cells will respond to these different stimuli and to start to re-vibrate themselves to the position that they're supposed to be in a healthy state. Which leads us to how do they get out of how do they get out of whack? Okay, and how they get out of whack is through 4 stresses. Okay, and the 4 stresses, no matter what particular avenue of practitioner that you go to, the 4 stresses are usually broken down into physical response, okay, or physical trauma, okay, emotional trauma, chemical trauma, and temperature traumas. Okay, let me just kind of break them down a little better. So you'd have temperature trauma, and it can be very subtle depending on the individual. Remember, each person's unique. But chemical temperature trauma would be mostly maybe a frostbite to most people, or heat stroke. Okay, that would be a shocking system enough. Secondarily, an emotional upset. Hey, you lose a parent, you have a divorce. There's numbers on the Holmes charts that tell you the more severe complications. Then you have physical traumas, and there's your car accidents, you fell down a flight of steps, and the emotional or the chemical traumas, and that's when you get into foods that you eat, maybe, or different drugs you may take, or vitamins that may not be proper for you. And what these all do is they send a shock wave through our bodies that is supposed to travel from point A, the brain, down into the different body parts to respond. Unfortunately, sometimes the shocks are so great that the body doesn't respond in the proper way, and they get stuck. And when they get stuck, we now have what are called interference fields. Okay?
Yes, that's what I was going to ask you. What is IF or if?
If, yes. Okay, those are interference fields, or I like to call them memory bank problems.
Oh, memory. I understand memory bank.
We talked about memory bank before.
Yes, I understand that.
Exactly.
So so what is it about these interference fields?
Well, the interference fields are basically an inability now of the body to communicate properly, kind of like, again, like a car that has a short circuit.
Yeah.
Okay? Looks great. Looks shiny.
Right.
Inside is all demoed. It's all propped up. It's got white tires, but it doesn't start, or it doesn't go effectively.
Right.
Okay. You get bad gas mileage. Okay. And in the body, what you do is you start to build up toxins in the body. Okay. And these toxins, unfortunately, what they do, they don't get removed. And when they don't get removed, they start to accumulate in the system, and they accumulate at different areas. Our job is to find out where have they accumulated, where are they coming from, and what can we do through using the rocks or through using different kinesiological approaches, what can we do to make them move so that they're removed from the system through the detox organs, okay, which are 3. Okay, and when they're removed, then the body now starts to, guess what? Get better.
Right.
Gets better on its own.
So are we saying that healing rocks really are geared for glands and organs?
You can, yes. You
for
can
muscles
use them.
as well? I really don't know.
Right, exactly.
And our audience doesn't know.
No, exactly. What we're going to show is, yes, they are. We can use them to stimulate different glands and different organs. We can also use them to stimulate different muscles.
Really?
And we can also use them to de-stress an individual. Okay.
And what about allergies?
We can also use them, which very nicely, we can place them on different acupuncture points. Okay. So it's nice. it's like a big acupuncture needle that doesn't penetrate the skin.
Oh.
Okay, that's why I like to look at these things, and people kind of understand that a little bit.
Right,
but that's
they
what
can.
they do. Yes.
What about headaches? If there's somebody out there with migraines or something, would they help with that?
Yes, they will, yes. And then there are reasons why migraines occur. Again, you have to investigate the individual to find out why the migraine is there.
Back to what you're saying.
Which, remember, we told you last time, the rules are where it hurts is usually not the problem. Many times it comes from other locations.
Right.
So we better investigate all the locations.
Right.
So, yes, it will. It will also be very useful in terms of treating a migraine, which many times, just for the audience's information, many times comes from the large intestine. That's usually where it comes from. Okay?
By the way, while we're on this topic, and we'll go back to the analogy. I want to do an analogy with the piano and the body. But before we do that, can you tell me, Doctor, when perhaps, how would you determine when a knee problem might not be a knee problem? It might be coming from something else, or something else hurts. It may not. Can you talk a little bit to that theme?
Yes, yes. I know you had asked me earlier if we would discuss this a little bit, and I'd be glad to. Again, understand that when an individual comes in, they're not mute, okay? Although sometimes they do come in that way, okay? But most times they do come in and they do have an understanding and a complaint, and they're usually very verbal about the complaints they come in with.
Right.
And they're very specific to let me know 15 different ways of where it hurts and how it hurt and how it initiated itself. To be honest with you, most of the people come in don't know where it came from. I mean, they'll come in and it's like, it just started out of the clear blue. I don't know where it came from. So that would be my first clue, to look a little deeper than to think, this is not a knee problem. This could be something else. Now, the person who comes in and says to me, I just fell down on my knee. I was running and my leg gave out and I bumped my knee. Then I'd be more inclined to think it may be specifically a knee problem. But when they come in out of the clear blue and can't come up with word, and I say, well, where did it come from? I don't know. And now you start asking questions and you find out 15 years ago, guess what? They had a problem someplace, and guess what? It really never ever went away. What happened is, like, these interference fields were initiated at that point. And the body has a great ability to kind of shift itself a little bit. And you can live with a shift, but in an inferior way. So most of the people that come into our office always have limitations. And that's what I tell them right at the beginning. I said, before we get started, we're going to do a couple of quick, simple little tests. And the first thing is going to determine if everything I ask you to do, you can do. I'm going to tell you right now that you're in the wrong office. I'm going to give you a suggestion to go see somebody else. Okay? And if there's things that I ask you to do that you're not able to do, then we're in the right office. And then allow me to go ahead and find out exactly where these problems are coming from, so we can connect your body so that all the vibrations of the different cells and the different organs are working in harmony. And they start to work as a team, and as a team you're much stronger than as an individual.
Wow.
That's how it works.
Good. I see.
Okay.
Now, a real good question which people might want to know out there is there an instant benefit from using Healing Rocks?
Yes. The nice part about the work is that typically the response is usually the next morning.
The next morning,
Usually
Doctor?
the next morning you'll see changes, yes.
Wow.
That's what's so nice about it. Occasionally,
beautiful.
though, the response is immediate, but usually the next morning, and there's a reason for that. And that at nighttime when you sleep, and it's very important to get a good night's sleep, simply because the body has proteins, okay, which are the makers of muscles and the makers of these tissues. And at nighttime, the body readjusts and takes all the broken down material and reabsorbs it and reconfigures it, so that it takes areas that are broken down and it takes those amino acids, which are little parts of the proteins, puts them together and builds a new muscle. And now all of a sudden the work that we initiated the day before now starts to recognize where it's supposed to go, and the healing component starts to take place. And that's when the change will occur.
Very good.
Yeah.
Now, we talked a little about chronic illnesses. This probably works best for chronic illnesses.
Yes, it's very effective for
Very
chronic
effective.
illnesses. Yes.
Okay. Now, what I'm going to ask you to do, is it true, to tell me if this is true? I heard that 80% of chronic illnesses are linked to diet.
Yes.
Is that true?
Well, what they're referring to is this. Not only do you have to, and remember, we talked about different parts of the body have a certain vibration.
Right.
And when they have a proper vibration, they can absorb properly. And believe it or not, what they absorb is they absorb nutrients that are properly vibrating at the same time. So if the vibrations synchronize, the ability of the cell or the body parts to absorb the food that you give it are proper. And in addition to that, the ability of the cell to use the food is proper. and the waste that the body produces that has to be eliminated, if the vibration is proper, is eliminated, and it'll go through the proper channels of elimination and be removed, and now you have a nice in and out and a growing component, as opposed to a in, damage, waste, breakdown, where you don't have a growth, you now have a destruction. And you can go to the nursing homes all around here, or you can go to the malls all around here, and you can watch everybody hobble. They all have a limp. They have shoes that wear out improperly. One shoulder's higher than the other shoulder. Their head is tilted one side. They have one eye half closed. They have swollen legs. They have swollen ankles. And that's basically the reactions to these areas that are not vibrating as well as they should. Their bodies are left in a destructive way. They're not getting the right foods. They're not getting many times the right protocols to make the cells vibrate in the right fashion. And because of that, now they start to destroy themselves. And this is called old age.
Yes.
So this is called an anti-aging process. This is how it's
like
introduced in the seminars. It's an anti-aging process.
Anti-aging process.
Yes. Yeah.
That
That
sounds good.
And it's a lot of fun to work with, because it's lovely to get calls or letters coming in about how much better people feel, how much more they responded, how much they're able to do this. You know, I can stand on my feet today. For the last 3 years, I haven't been able to stand on my feet, and today I can walk. I'm not having the aches. My cramps are gone.
Will it reduce swelling in certain areas, I'm sure?
Oh, absolutely. Absolutely. Including weight.
Yes.
Yeah.
Weight, too.
Well,
Whoa.
if you get the body working properly, it'll start to, with the proper foods in and the proper use of the cells to exercise properly, you'll be able to lose the weight that you couldn't lose before. It's got a lot of positive benefits, no negative benefits. That's the nice part about it.
Good. Well, Doctor, while we're on the theme of diet and whatnot, and not saying that what we're going into has anything to do with it, but it might, because there are what we call health destroyers, and if we eliminate some health destroyers, we'll probably have better health. Now, could you name, just for the sake of the audience, some health destroyers that would make this process work even better, even though it'll still work?
Sure. A lot of them are common sense ones, like don't fall down. Don't fall down. That's an easy one, okay? But ones that you wouldn't think of, ones that are not talked about. Scarring, for example. There's ways that people can do, and I'm going to try and touch, if we have enough time, on home therapies that they can do for themselves.
Oh, really?
Okay, so scarring, for example. Now, if they have surgery, obviously we want to avoid surgery if we can, okay? Now, obviously I'm not dumb enough to think that all surgeries can be avoided, but there are a lot of them that can be. Now, if a surgery does occur, or maybe you've had a cut with stitches in it, or even little tiny scars many times, and if there's questions, obviously we have testing procedures to evaluate which are the important ones. But if there are no scars or one scar, one simple thing you can do is use vitamin E cream, okay, or wheat germ oil, and or vitamin E oil, and massage the scar with the vitamin E oil. Okay, that reestablishes somewhat normalcy within the scars. Sometimes we'll also use the healing rocks on the scars. There's a variety of different things. Laser beams many times are used on scar centers.
You wouldn't think a scar would cause a problem.
Would leave a lasting memory. Yes, it does. Okay, because what it does, it's just a big roadblock. So when a signal goes to it, it can't go through it. So now it's got to go around it. So we've all driven in detour traffic, and you expect to get to the studio this morning at 12 o'clock, and you hit a detour on Williams Street coming over here, and the next thing you know, it's 3 or 4 minutes later. So if it's an important signal in your body, guess what happens? That function of that part that receives the message doesn't occur, and now you start to deteriorate. And of course, it's a big domino effect, and the next thing you know, another part breaks down, and then you start to posturally change, and you start to lose weight, or not weight so much, but you start to lose the shapes of the bones, you start to develop arthritis, you start to develop aches and pains, numbnesses, tingles, paresthesias, things of that nature.
I see.
That's how that works.
Okay. Well, Doctor, we're going to take a break right here, and when we come back, we're going to talk about how these healing rocks really work.
Absolutely.
And have a demonstration.
Absolutely. We're nice enough to have one of my patients came in today, a good friend also, and we'll be able to show some different interesting features that are happening with her.
Good.
That's good.
I also want you to tell us how a piano has to be fine-tuned and how our body will be fine-tuned with these healing rocks, correct?
Absolutely. That's correct.
Right.
Absolutely.
Okay.
Terrific.
All right. Stay tuned. We'll be right back. Welcome back to Dialogue with Doris. I'm Doris Herbert Robinson, your host. We're talking about healing rocks, synchronizing the body's vibration. And we have with us the noted local chiropractor, Dr. Richard Collins, and his patient, Julia. So, Doctor, could you tell us the correlation between fine-tuning a piano with a tuning fork and fine-tuning the body with healing rocks. And then you'll demonstrate on Julia.
Yes, I know we have a few minutes, and I want to thank Julia for showing up today. Julia just started with some procedures that we're going to show in demonstration to the audience. But yes, the question is the piano and how it would respond very similarly to a body. And if you think of every cell in the body as being a piano wire, that a key will hit. When you hit the key on the piano, a little lever goes down and hits that particular wire, and it makes a sound. The same holds true in the body. Now, master piano tuners will use little tuning forks. What we use are these little called coherence generators, okay, and we'll show later, okay, you can see there's a coiled material on the inside, again, man-made, okay, with energy sources on either side that will allow this to emanate just like a tuning fork, except this has the ability to send out numerous frequencies. And when I first started doing this work, we used to actually use tuning forks. I have actual tuning forks. I went up to a piano company to actually invest in. And we'd use them, and different tuning forks would actually respond to different parts of the body. This particular gentleman who invented these has taken all these tuning frequencies and placed them into this one particular apparatus. So it's very, very, very durable and very usable in all parts of the body, but more importantly, it's very, very safe. So let us get started. So as we talked earlier, we talked about specialized kinesiology, which is a muscle testing procedure. It's very important, and Julia's already been checked to make sure that everything works on her, so now we can investigate more thoroughly what's happening with herself. I'm going to touch just on a few things today so you have an understanding of what occurs and how it's done, so you can see the procedure is very safe and very effective for all age brackets, whether they be young children all the way to the senior citizens in this particular area. So what we'll use, we can use many muscles, but the easiest muscle to use for demonstration purposes is the finger muscles. So we're going to have Julia use her ring finger, okay, the fourth finger and the thumb. And what she's going to do, she's going to hold them together like an O, not like a TP, but like an O. And I'm just going to ask her to pull them together as I pull them apart. And they're very, very strong. You can do this at home, because you can use this, and if you ever call the office, we'll give you information how you can determine if anything's good for you or not. There's a detoxing procedure that you can use by yourself at home. So I'm going to ask her to check different things. Now, I know she's had problems with some work around in the mouth area. So the first thing I'm going to check are her teeth. So these are one of the things Doris asked about. Do we have different things that can affect you? We talked about scars. Now we're talking about teeth. Dental amalgams, infections that are not noticed many times. People don't go to the dentist. Decays of the teeth, silver fillings, silver and gold together, in addition to different food groups that are pesticide. But these are the things that we do in the office. So to check them very quickly, Julia takes her one finger. She's going to put it across the cheek. Now, the upper jaw is broken into three parts. And as she holds that particular spot, we hold her fingers, okay, and she's nice and strong. There's not a problem there. You go to the middle section of the teeth, we squeeze, okay, and there's not a problem there. We go to the section over here, hold, okay, and we have a problem right there. Her fingers come apart. So that means on this side of her teeth, there are one of the last four teeth, not the wisdom tooth, one of the last four teeth has got a problem. We will further investigate in a few minutes. Take this finger, put it on the lower section, squeeze the fingers, they're nice and strong. You go to the center section, we pull together. Okay, she has another problem here in some of the central teeth in the front on the lower, and come over here, squeeze them together. Next, I want to check her wisdom tooth. It's interesting. You'll go to the dentist now, and all of them will tell you that creates heart disease, okay? The pressure point, and where that comes from, is usually the wisdom tooth. So to investigate the wisdom tooth, what we have her do is take all her fingers, put them together, and have her touch right above the belly button, which is an acupuncture point for the wisdom tooth, also for the heart, also for the duodenum. Squeeze your fingers together, and she's very good right there. And the other piece that we want to look at, just as an investigation, because I'm going to scan the body very quickly in a second, is another part of the detox system, or the body's ability to remove its toxins, called the bile duct, and she's very good also. Take two fingers. I want you to touch right on the chest right here. Hold your fingers together. This one looks really very good. We go down here, right next to the belly button. We squeeze the fingers together, and we have a little weak spot here. So we know I have a little issue here. This is a colon problem, okay, and that's the most common thing. She also has headaches, and as I talked to you earlier in the talk, a lot of times headaches come from the bowel or the large intestine. That's what's happening here. We'll go to the other side. Squeeze your fingers together. She's very nice and strong here. And the last part is the kidney. If you touch right there, good. Squeeze the fingers together. and she's good and solid right there. So we know she has a little problem right here, and that's usually due just to the foods that you eat, okay? Many times the foods you get in the store, some people eat fast foods, you have a tendency, and it could be from many, many years ago where she might have gone to a fast food restaurant and it didn't agree with her. It's disrupted the normal components of her gut, okay? One thing that people can do at home, yogurt's very good. Plain yogurt, okay, not with the fruits, plain yogurt. Put your own fresh fruit in. Cottage cheese, okay? Those are very good things on a daily basis to have. Half a cup per day for each individual. Now, just to go back real quickly, we'll look at just the lower, because that's an easy section for her to check. Just take one finger and just touch on the eye tooth. That's the pointy tooth on the side, on the lower teeth, right where the tooth meets the gum. Good. And squeeze your fingers. That one's good. Go to the next tooth over. Good. That's good. Go to the next tooth over. Good. That's the problem tooth right there. So we know she has a problem with that particular tooth. Go to the next one. Squeeze. Good. And go to the next one. And squeeze. And go to the next one. And squeeze. So we know it's just the one tooth. So go back again to it's actually the lateral incisor, and just touch it with a nail of your tooth. One more over this way. There you go. And squeeze together. Okay, and this is strong. So at this particular point, what I would do is I would then do chiropractic evaluations where I'd put her on her stomach. For demonstration purposes today, that's not really of interest. So, okay. Now, the other thing we want to show are the rocks themselves, okay? So what we would do, one of the most common things we'll do for people, we just place them on the body in just different positions. Good. Okay? And if we had an allergy, for example, what I would do is if she said she was allergic to hamburgers, I'd have her bring some hamburgers in, place it in her mouth, hold the fingers together. If it was a problem, it would weaken, and what I do is just leave her here for 10 minutes with these rocks on, stimulating the different parts of the body. The other most important one that we do, okay, would be this. We actually take the rocks, okay, we place it underneath here. Oh, okay. And we take the other one, we place it underneath right here. You got that? Okay. And what this does, this is very, very important for chiropractic evaluation. So what I would do is I'd lay her down, we check the fingers, and she gets weak. It's an important part for her to have them. We leave her here for 10 minutes, and what these are doing at this point, they're actually taking the head and the pelvis. Now in chiropractic, there's a big theory called cranial-occipital technique. And what this does, it gets really deeper into the cells to make it more efficient in terms of repositioning the head and the symphysis joint of the jaw, lining up with the pelvis and the symphysis joint of the pelvis. And what that does, it allows the person to be very straight. And we all know from any chiropractor you've gone to or anybody who really has any understanding of healthcare, the straighter you are, the more effective and the more efficient your body is going to work. So this is pretty much how you use the rocks. And we can use them for a variety of other procedures. But that's the basic premises. So thank you.
Thank you, Dr. Collins, and thank you, Julia. Well, I hope that you learned about healing rocks, and for more information, check the credits at the end and you'll find out how to get in touch with Dr. Collins, and hopefully you'll tune in again next time. But for endings, again,
As
thank
always,
you.
yes, thank you.
And you'll be back, because this is your third visit on Dialogue with Doris.
Yes, it is. I've been fortunate enough to be here 3 times. Yes, thank you. Yeah.
Okay, now for our Dialogue with Doris tidbit, which I really got out of Dr. Collins' office. And it said, health is our most precious commodity. And I'm telling you to make sure you stay healthy, because without it, all else is for naught. Bye-bye till next time.